Hey everyone, I'm from Med School. Today we are going to discuss about the world endemic problem today, which is simply called as corona. But the scientific name of this viral infection is COVID-19. So let's see what is this COVID-19 virus. It's a spherical shape enveloped single-stranded RNA virus. You can see the structure simply something like this. Then what happened during this pathogenesis? If a patient is corona positive and if he sneezes or cough, what happens? These airborne droplets are released into the environment, and this released airborne droplets can be inhaled by any other patient or any other person within 1 meter apart from this patient. Or else, if the patient touches his nose and mouth area, then these airborne droplets can contain in his hand, or sneeze to an object, then this object may contain these viral particles. And if someone touches these objects, or if this patient, what happens? They can acquire the viral particle in their body. Then, while touching his nose and mouth area by this unwashed hand, they can easily transmit it to the respiratory passage of the any person. Then what happens? This is the respiratory epithelium. Then this coronavirus comes to the respiratory epithelium, which leads to damage the respiratory epithelium and causes inflammation. During this damage and resulting inflammation, due to the destruction of this epithelium, these viral particles can enter the blood. Via the blood, these viral particles can be transmitted all over the body. Then symptoms appear. This appearance of symptoms may vary from patient to patient. Maximum time of appearance of symptoms are now measured as 14 days. Within 14 days, patient should get the infection or get the symptoms of that infection. But this time period vary from patient to patient depending on their immunity and the strength of their body. So, when we talk about the symptoms, there are main symptoms, some other symptoms, and some symptoms which may happen in very few population of the world. Main symptoms are fever, tiredness, and cough. And other symptoms like shortness of breath, aches and pains, and sore throat can be possible for these patients. And also, very few population may get diarrhea, nausea, and runny nose as well. And with the time, any infection can be cured. This curing phase, we called it as resolution phase. In resolution phase, what happens is antibodies are formed within the patient, and these antibodies are act against the antigens present in the viral envelope or viral particles. Then antigen antibody complex will causes destruction of the viral particles, which leads to resolution or the curing of the disease. There are some important things we have to know about this virus. First one is this is a respiratory virus. For example, common cold, SARS virus, some respiratory syncytial virus, all these are respiratory virus. So they should be entered via the respiratory system like nose and mouth. And also, the most important thing is this coronavirus has severe stage as well, which leads to patient become acute respiratory distress syndrome, which is called as ARDS, which leads to destruction of the tissues and accumulation of fluid in the lungs, which ultimately can leads to death as well. And also, for the coronavirus, there are high-risk population. First one is smokers. These smokers having low lung capacity due to destruction, therefore they may develop severe stages quicker than normal healthy adult. And also in patients with chronic illnesses. In patients with chronic illness, the thing is they are having low immune system. Due to that, they may take comparatively large time for the development of antibodies against this virus, which may lead to death. For example, patients with diabetes, cancer, HIV, and kidney problems like chronic kidney disease. And also, population who are over 60 years of age also are named as high risk population as their immune system is not well as the younger population. So, what we can do? We can prevent the occurrence of this coronavirus. For the prevention, WHO recommends washing your hands regularly with soap and water, or cleaning with alcohol-based hand rub is very important. And the second one is to maintain at least 1 meter distance between you and the people who are coughing and sneezing. And we have to avoid touching your face unnecessarily. Then we should cover our mouth and not nose when coughing and sneezing. The main thing, you have to stay home if you feel unwell as well. And if you are a smoker, please be away from smoking. Then be away from large gatherings, large crowds, and stay at home and be safe. So if you like my channel, please like and subscribe.